Good morning, good afternoon, good evening to you all, ladies and gentlemen. Welcome to the second day of the WHO Global E2P Summit 2023, and thank you again for joining in the first day. This is the second global event of its kind organized by the World Health Organization. I'm really thrilled to see such a diverse group of professionals gathered here today. My name is Fadi Al-Jordali, and I will be your host throughout this event for today. A few housekeeping matters I would like to draw your attention to. The summit is going to be recorded, and this is exactly what we have done yesterday. The recording will be made available later on the WHO Summit website. Please use the chat and the Q&A for any questions, comments, or suggestions. As you know, we have simultaneous translation in English, Arabic, French, Portuguese, Russian, and Spanish. You can also feel free to write in any of these languages in the chat. Click on the interpretation button at the bottom of your screen, and if you would like to hear this summit, of course, in different languages. We have also tweetable messages that you can find in the chat. Please feel free to use those and tweet or post on social media. Our chat moderators will also add the link to the EVIPNet LinkedIn group, so everyone is welcome to join. Let me start by saying, just like yesterday, the summit today will be taking place over 2.5 hours today as well as tomorrow. Now, the inaugural day for the first day of the 2023 WHO Global Summit highlighted the significance of evidence to policy in addressing global challenges. And as you heard yesterday, it consisted of inspiring keynote interventions, a WHO update on the implementation of the EVIPNet call for action, and an evidence map on the available empirical evidence on interventions to support evidence to policy and decision-making as a foundation, certainly, for the WHO research agenda. And we had also yesterday the first ever funders panel, which was really quite interesting to hear. So I have to say, just if I'll take 1 or 2 minutes just to summarize maybe some of the take-home messages from yesterday. I think it's very critical as we actually more plan and start the day 2 of the summit. But across the sessions yesterday, speaker from day 1 emphasized the need for leadership and coordinating to advance collaboration efforts and building trust, integrating systems to promote global collaborations and collective learning in evidence to policy, and promote citizen and stakeholder engagement to advance evidence to policy mechanism. And we'll hear more about that today. So just to summarize some of the key highlights from yesterday, Sir Jeremy Farrar, the WHO chief scientist, pointed out in his welcome note that it is really, and I quote here, it is at the interface between science and policy that real progress is made. At the same time, Sir Patrick Vallance, former chief scientific advisor to the UK government, emphasized the need for strong evidence systems that support policymakers, interdisciplinary collaboration, and to build trust by urging evidence intermediaries to provide evidence, not opinion. And more importantly, to make sure that this evidence is understood by policymakers. He emphasized as well that it is about policy advice, not policy prescription. Professor Salim Abdul Karim, director of the Center for the AIDS Program of Research in South Africa, described a series of case studies highlighting the valuable lessons related to conducting timely and rigorous research and conveying both known and unknown information through effective communication. The Honorable Minister of Health of Chile reconfirmed the importance of the EVIPNet call for action by emphasizing the need to institutionalize evidence to policy support structures and engage citizens and stakeholders in decision-making and dialogue. At the same time, yesterday, we were also updated on the EVIPNet call for action and heard about the result of the mapping exercise, the art and science of using evidence, and what worked in supporting the use of evidence. Briefly, during the interactive plenary session on catalyzing evidence-informed decision-making, Tanya Kugenemer, WHO Unit Head, Evidence to Policy and Impact, jointly with her regional colleagues from WHO, provided updates on the progress and lessons learned since the 2021 EVIPNet call for action was launched. And a lot of work has been done since then. Laurent Langer, Executive Director of the South Africa Center of Evidence, noted that findings from the evidence map that they have done indicated that little evidence exists about the impacts of supporting the use of evidence, and that moving forward, a WHO global research agenda will be needed, which is really in the work now, to prioritize and help address and close the existing research gap. And finally, again, we had really an first ever, I would say, funder agenda, funders panel addressing and exploring the funders agenda and expectation related to evidence-informed policymaking. The funders panel chaired by Jeremy, and with 5 funders that were present, shed really interesting insight into the funders' perspective and experiences. They called for more collaborative funding efforts, citizen engagement, as well as aligning, which is very important, aligning funding timelines with policy priorities and uptake. Now, today, based on what we have learned and the insights that we got from yesterday, today we will debate experiences of cross-evidence ecosystem collaboration and partnership. We will also explore ways of engaging citizens in providing evidence synthesis and support. We will also have 2 interactive sessions so that participants can provide their insights. The first session is organized and shared by WHO Euro Regional Office. So without further ado, I would like to introduce our moderator for the first session of the day, Mark Grenap, Regional Advisor, WHO Regional Office for Europe, who will share the session on working together, building collaboration and partnership across the evidence ecosystem. And this will be really an interactive session. Mark, over to you.
Thank you so much, Fadi. Yesterday, we had extremely interesting and insightful opening day of the Evidence to Policy Summit. I was delighted to hear in several interventions calls for bringing policymakers and evidence producers more closer together and forming stronger alliances across evidence ecosystem. In this panel, we will reflect more closely on the importance and potential of cross-evidence ecosystem collaboration to enhance the use of evidence for health decision-making. We will talk about opportunities, frameworks, and good practices that can support the institutionalization of collaborations and partnerships at various levels. Let us dive into the first part of today's session, the panel discussion. It's an honor and pleasure to have 5 distinguished panelists to share their experiences and insights today. You should find their bios on the link copied in the chat. And who we have today with us? We have Ruth Stewart from Africa Evidence Network, South Africa. We have secondly Soledad Ross, Open Science Project, Universidad Central de Chile, Chile. Then third panelist is John Lavis, Director of the McMaster Health Forum and WHO Collaborating Center for EIP Canada. Then also we have Holger Schünemann from WHO Collaborating Center for Infectious Diseases, Research Methods and Recommendations. He's also Director Cochrane Canada and McMaster Grade Center, as well as he's from a professor from Humanitas University in Italy. And finally, Mouna Jamaluddin, head of the HTA Department, Instance Nationale de l'Évaluation et de l'Accréditation en Santé, Tunisia, as well as she is co-chair of GINATA Collaborative Working Group International Network of Agencies of HTA, Health Technology Assessments and Guidelines International Network, GIN. Thank you for being with us today. And without further ado, let's start with our discussion. And who would be better to talk about the importance of the collaborations, partnerships, and networking to advance the use of evidence in decision-making than Professor Ruth Stewart, who is the founding member of African Evidence Network and has pioneered the idea of evidence networks. I'm sure we have a lot to learn from Ruth's extensive experience in building, growing, and sustaining an active network that includes over 4,000 people with different backgrounds and roles. The floor is yours, Ruth.
Thank you very much, colleagues, and thank you for the warm welcome. It's lovely to see participants joining from across the continent and further afield. So as you heard, I was the founding chair of the Africa Evidence Network. We're nearly 5,000 people now from across the African continent. And it won't surprise you to hear that I'm very passionate about partnerships and relationships. I wanted to start by quoting my friend and colleague from Brazil, Laura Boera, who says that evidence is not a substitute for humanity. And whenever you talk about humanity in this part of the world, I'm sitting in Johannesburg, we talk about Ubuntu. And Ubuntu is a African philosophy that says, I am here because you are here. We need each other. And I have some visuals for you. There's no point in us being a single marble in the world when we're trying to influence evidence-informed policy. It doesn't matter what a shiny marble you are, you still can't join that interface between science and policy if you sit alone and try and work alone. We need partnerships to be able to make a difference. And only by working together do I believe we can really make evidence-informed decision-making a reality. A second point I wanted to make that comes to a particular story. So one of the first times I came to work in South Africa, you can probably hear from my accent that I have worked in the UK as well. I came out in 2001 as a very young researcher to support some workshops, building capacity to use research evidence in HIV prevention. And my team and I arrived from London, and we committed what I think is one of the deadly sins of our field, which is to fly into another country without understanding what is already happening there and think that we can make a difference. And my colleagues in Cochrane, South Africa were not impressed, understandably, because we'd flown in, we hadn't told them what we were doing, we hadn't asked where we might support the bigger agenda that they were working on. And it's a pleasure now to share that we've improved and we've learned how to work together. Some of you might know Brené Brown's work, where she talks about leadership and building trust, because we can't just have partnerships and relationships and MOUs and contracts, whether I arrive in South Africa and have a beautiful contract laid out with Cochrane South Africa. That's not going to help. We need to have a trusted relationship. And Brené Brown talks about another jar of marbles, and she says we don't build trusted relationships by saving one another's lives or donating large amounts of money to a cause, doing something big. We build trusted relationships by adding small marbles to a jar of relationship and partnership and trust. And whether it's our colleague Fadi, who introduced this session, greeting my children when he met them in Pretoria last year, or Tamara from the same Cochrane, South Africa, who sent me a lovely message yesterday. I hadn't spoken to her for over a year. We've been busy in our separate corners, but sent me a lovely message yesterday to say how much she had enjoyed my colleague Siziwe's chairing of the day. These small marbles are what build trust. And I think it's really important that we consider that, and when we think about how we build partnerships, of how to build small and trusted relationships. And my last and final point is about actually a challenge to science. So when we sit in academia and research, and I think many of the people here come from some research or science background, we are shocking when it comes to the silos in which we work. So it doesn't matter how shiny, sorry, you can't see my marbles very well, but it doesn't matter how big and shiny our marble is if we work in isolation with one another. We often talk about how the policy environment needs to have an institutional change that needs to shift in how it engages with evidence. But I want to challenge those of us who work in science to say that actually I think it's the evidence production world that needs some serious disruption to get out of our jar and get into jars with other people and start to build trusted and genuine relationships. Thank you very much.
Thank you, Ruth. And I hope that today's broader this evidence to policy summit will be a good facilitator for building more of these marble jars that are together in the bowl. And now moving on to our next panelist. And yesterday at the funders panel, it was strongly emphasized that in order to solve complex societal problems such as health and climate change, policymakers need evidence from a range of disciplines, and not only health. Working with other sectors is one of the aspects that our next panelist will touch upon. I'm delighted to present our next panelist, Dr. Soledad Quiroz Valenzuela, who in addition to her researcher role, is also an elected vice president for policy at the International Network for Governmental Science Advice. So Soledad, I hope we can spotlight you as well. Hi, Soledad, the floor is yours.
Thank you. Thank you, Marge, for the invitation to this panel. I'm really honored to share with you some ideas. I have been jumping from one side to the other of science policy for several years already. I started as a biochemist, and then I decided I wanted science to really have some saying in how we can increase or really put science in the center of development. And the only way to do that is through policy. So I went for a master's in public policy. And I've been learning from many people throughout the years. And this is what I've wanted to, in a small nutshell, what I wanted to share with you. If you can advance to the next slide, please. First is something that Marge already mentioned, and we all have seen lately. Problems are so complex. One of my professors used to say, all that is easy is already done. So all that is left is very complex. And it's getting more and more complex with the years because we have accumulated so much knowledge that now we know that if we tweak something in one place, it's going to have effects, butterfly effects on all the other places. And climate change and health are two things that we maybe did not expect to be connected, but they are. And there are very strong connections there, and we see it every day. And the only way to approach and solve those problems is through collaboration. So we cannot avoid that, even if we try to solve our small problems. The other thing is we cannot prepare for everything. In Latin America, we are more reactive. We react to problems. But there are countries where you prepare with a lot of time, you have all these systems to prevent problems from happening. But even when you are trying to prevent things from happening, we cannot prepare for everything. There is always something unknown. And COVID showed us, well, we could foresee that we will have another pandemic in the world, but we didn't know what kind of pandemic, what sort of treatment we could use, what sort of problems will arise. And so, again, the only thing that can help us approach a solution to those problems is if we share our knowledge. And that's why I'm so passionate now about open science, because that brings us the tools to share the knowledge. And the last point is because it's much more fun. Creativity is key when you have to come up with new solutions to problems. And creativity is much more open and bigger when we are talking to people we haven't talked before, with views of the world, of the problems that we did not expect it. So having fun creating new solutions that can really push in a direction that we want to push policy and development without leaving anybody behind has to be done in collaboration with creativity with others. If you can go to the next slide, please. What I have learned in these years is that this collaboration can sound easy, but it's not that easy. Because you have to be prepared, not just to teach to others what you have learned. You have to be prepared to learn from others. And when you are experienced in a field, you are not always prepared to teach, to learn from other fields. So Peter Gluckman always talked about hubris, how much hubris makes things difficult when you try to communicate with policymakers. Well, I think hubris is a much bigger problem, because when you're trying to do interdisciplinary research or interdisciplinary work, can be a big hurdle too. So be prepared to teach with patience and be prepared to learn with also a lot of patience. The other thing is never assume anything. You are talking to a person who sees the world in a different light. So when you are found with strange ideas, strange questions, things that don't make sense or even collide head to head with what you think, just ask the question, why do you think that? Why are you saying this? I don't understand it. And that goes in also in the line with what I said before, learn. Because it's easy to assume the other person has other interests. They're trying to do something in their best interest and not a shared interest. But if you ask questions, you will find interesting answers that maybe you never thought before. And you can approach the problems with a more wider vision. And that goes into the next line, invest in time in common definitions and goals. You can try to meet a lot of people, but if you don't define common goals, it's very hard to work with them. You will end up in meetings, those meetings that could have been an email, because it's just informative. You need to come up with common goals and common definitions. I have been in conversations where we have been trying to reach goals together, but our definitions of violence or our definitions of goodness or our definition of support are so different that we cannot reach those common goals. So set up some common language definition and then goals, and that's going to help your collaboration move forward. And lastly, but not least important, of course, is be patient. This takes time. It takes time to build a good relationship with people. We are not used to take time to do things, but you need to take time with people and with ideas to really have a strong relationship that can last longer and have productive results. So that's what I wanted to say and share with you today. Thank you.
Thank you, Soledad, for highlighting the soft skills side of the building partnerships and collaborations. Referring to yesterday's keynote speaker, Patrick Wallace, who made a clear point that there is a need for a knowledge support system to help decision makers to keep up with advances of evidence science and research and development. Now I will hand over to Professor John Lewis to elaborate more on that topic and what collaboration is needed to enable this. So John.
Thanks very much, Margie. And if we could pull up my slides, I just have a few. I'm going to talk about 3 types of collaborations. If we could just go to the first slide. And these are collaborations required for providing timely, demand-driven evidence support aligned to advisory and decision-making processes. The first area that I wanted to talk about is we need collaborations within each country, or what I would call domestically, among groups contributing different forms of evidence and other inputs to advisory and decision-making processes. And we need that happening in central agencies like ministries of finance, in science and technology departments, in line departments like health, but also in legislatures. So think about renovating a kitchen where you need a plumber and a tiler and electrician. Those are the trades. But we also need general contractors, and a VIPNet, or Evidence-Informed Policy Network, is a great example of a network of general contractors. They bring in needed forms of existing evidence from the trades and rapidly contextualize it for a given decision in an equity-sensitive way. Yesterday, we heard from a few science advisors. I would love to see science advisors play a role in conducting the evidence support system orchestra, all those different musicians, not necessarily as advisors playing every instrument as a subject matter expert. And ideally, they would be selected based on their general contractor experience, not only their experience as a researcher or as an innovator. So we need those collaborations within each country. If we go to the next slide, I think we also very powerfully need to think about how those general contractors bring these different forms of evidence. On the left, you'll see many forms of evidence: data analytics, helpful with problems and their causes; guidelines and so on, helpful with selecting options; behavioral and implementation research, helpful on the implementation side. We need those forms of evidence domestically, but we also need the best evidence from around the globe so we can learn from other jurisdictions. But we also then again need other types of information. We can learn from people's direct experiences with key informant interviews. And as you'll see in the top of this slide, we can also learn from everyday citizens, their lived experiences. And in countries like Canada, we have a lot to learn from Indigenous ways of knowing. If we go to the next slide, I'll talk about another form of collaboration across countries. And this is among groups providing timely, demand-driven evidence responses to questions emerging from advisory and decision-making processes. Groups like a VIPNet supporting decisions about public health and health systems, learning from each other. We in Canada learned a lot about how to set up a rapid evidence unit from our colleagues in Uganda. That type of cross-national learning is essential. So we need these general contractors to be learning from one another across countries. And the coalition of partners, I think, has a key role to play here. And we're going to be hearing more about this on day 3, so tomorrow. If we move on to our final slide, I also think we need collaborations, both globally and domestically, among the many of us who provide timely, demand-driven evidence support to first those maintaining global public goods like evidence syntheses. We were asked a number of months ago to, in only 3 business days, say, what have we learned about climate adaptation strategies relevant to our country? Because a machine learning driven living evidence synthesis existed, we could pull down the relevant studies incredibly efficiently. So groups like ours and many others providing evidence support need to be driving the agendas of those living evidence syntheses and making sure they're fit for purpose. But we also need connections between those providing timely demand-driven evidence support and those working with everyday citizens, those trying to put evidence at the center of everyday life. And this is actually the focus of the very next session. It will start in about an hour as part of this summit. And it's part of the broader Cochrane Evidence Commission WHO EVIPNet webinar series, of which it's a part. So we need many forms of collaboration within countries, across forms of evidence, across countries for those of us providing timely demand-driven evidence support, and to those who are maintaining these global public goods and trying to put evidence at the center of everyday life. I'll leave it there, Margie, and turn it back to you. Thank you.
Thank you, John, for bringing us the whole range of different collaborations that are needed to support the evidence use in decision making. Now let's expand a bit and take a health systems view where not only policymakers use evidence to guide decisions. Frequently the same evidence-based evidence synthesis is also used for guidelines, health technology assessments, regulatory and other bodies in their decision-making processes. How to ensure that these parts of health decision-making canvas is well connected and collaborate within evidence ecosystem. Now, Holger Schünemann will present a framework of how to better understand those linkages and enable collaboration. Holger, the floor is yours.
Great, Margaret. Thanks very much for having me. I'm going to start sharing my screen. I hope you can see it. And I also have just a few minutes to contribute to this session. I hope you can see it. Is it there? Okay, great. So, Margaret, as you introduced, I'm switching gears a little bit and thinking very practically about how to connect different players in the evidence decision-making space. We've done work with WHO, various groups at WHO, a country office, WHO Euro, WHO headquarters, and country decision makers to think about how to best create bridges between disciplines that all use evidence synthesis and go beyond traditional partnerships that already exist, such as in the HTA guidelines and systematic review work. Our goal was to define the factors that influence a decision, and this is the publication that many of you have seen. But what came out of this consultation and that work is that obviously evidence from primary research can be summarized in systematic reviews, and it is extremely helpful if different players in the healthcare system collaborate on identifying the key questions using standardized formats. And what we actually did find is that these decision makers do use similar formats to formulate important questions. So we thought to bring together HTA guideline developers, obviously, but also link in, for instance, WHO essential medicine list decision makers, coverage decision makers, and those who look at quality in the healthcare system, and of course, those that work in the evidence-informed policymaking space. What we found in this work was that most of these different decision makers use a set of key criteria that are listed here. The benefits and harms of any intervention play an enormously important role, although they make not all decisions, obviously. Values, cost, and the certainty that we have in the evidence that supports any decision-making around interventions. Where these different decision makers differ is listed here. There's often different terms used for very similar concepts, and obviously that is something that can be fairly easily overcome, but there's also important differences. All of these on the left-hand side use modeling, and then draw conclusions. Modeling is almost always necessary. The first two on the left here, HTA and guidelines, often end with recommendations. These others make decisions, and policymakers like to see options as opposed to being confronted with decisions that these other groups are making. This leads to products, a very special group, and this is a group that we need to reach out to because they use slightly different approaches, although similar criteria, are regulators, both in the drug as well as in the device and in the environmental health space. That obviously is being fed back into the clinical, public health, and health system space, where implementation research in particular then leads to complementing the cycle of the evidence ecosystem of health decision making. This framework it has proved for us at least to be quite useful in connecting with other groups, and I'm going to show two very quick case scenarios where we've applied it. So one is in a landmark public health decision on essential medicines for multiple sclerosis, where we brought together Cochrane, WHO Collaborating Center guideline developers, HTA guideline groups that were public, the Multiple Sclerosis International Foundation, for instance. And as I said, this led in a concerted effort to listing new drugs on the essential medicine list, and leads to very specific knowledge mobilization efforts. The second example, just quickly to mention, and John, for instance, referred to working with the indigenous communities in Canada, which will play a hugely important role in these post-COVID-19 condition guidelines, where we are bringing together international players in the field to bridge gaps between, in this case, key HTA agencies, the guideline community, Cochrane, quality assurance and quality metrics developers, which are often disconnected from that decision-making space. And one of our goals here is to think about really that working together is to bring together international groups to interpret evidence together, which will lead to hopefully a reduction in confusion and mistrust with evidence to decision frameworks as a base case. These evidence to decision frameworks based on the decision criteria that you're describing there, and based on systematic reviews around that knowledge. And that includes collaborations with low and middle income countries. So two case scenarios very quickly, where there's some theory and practical work is being applied, and there will be many more hopefully in the future, so that we can move, like in this last effort in particular, to interact much more with policymakers. I stop here, Mark.
Thank you, Holger, for guiding us through the framework of a theory of everything. So, and now we are coming to our last speaker, who is going to give another illustration to exemplify this collaboration between seemingly separate worlds of evidence-informed decision-making, the guidelines and health technology assessment, where our speaker, Muna, has experience in both national and international level.
Thank you so much, Maike. So you will share the slides. Thank you so much. Good morning, everyone. It's an honor to be here, and thank you for the opportunity to be able to share some thoughts. So in my presentation, I will focus more on the collaboration between Asian guidelines, since I've been working on this since a while in the GDATA group. Next, please. So as Holger explained well, decision-making disciplines, they have a lot in common in terms of evidence, in terms of methods, in terms of processes. For example, Asian guidelines, they both start with the people question,
And then they use, I would say, similar criteria, even though the terminology can be different, to move from evidence to recommendation. They also inform each other, but they operate separately, unfortunately. There are a lot of institutions, especially those that are producing health technology assessments and clinical practice guidelines, who are making this collaboration a priority, but there are a lot of challenges, including the workload of these institutions, which make aligning the work programs between HTA and guidelines department challenging. I will, for example, bring the example of my organization, INEAS, which is producing HTA guidelines. One of the challenges is the fact that the demands, they come from different actors in the healthcare system. For instance, clinical practice guidelines are not initiated following demands from scientific societies, whereas health technology assessment is initiated following requests from National Insurance Scheme to introduce the technology in the benefit package, or from the Ministry of Health. So it makes it complicated to align the work programs. Next slide, please. So, as you know, strengthening collaboration, I think, is a must. It's important because collaboration will reduce effort application in terms of time, in terms of resources consumed. Collaboration will allow knowledge and expertise sharing between, different communities. Moreover, collaborating is important in order to harmonize decision-making at the policy and at the clinical levels. And this will ultimately lead to more consistent and coordinated messages to patients. And collaboration will for sure reduce heterogeneity in terms of decision-making and some of its implications, like, for example, inequity and judicialization of healthcare, or patients going to courts in order to obtain funding for the technologies they need. And it is an increasing and worsening phenomenon now in low and middle income countries. At the end, collaboration is important in order to deliver coordinated messages and close the gap between evidence, practice, and policies. Next slide, please. I would say, so dialogue is very important. Dialogue at the international level, but also the dialogue at national level between different actors of the health system in order to align a number of items that were well explained and reported in the Theory of Everything paper that was presented by Holger. So it's important to work on aligning priorities for evidence synthesis. And I think here, health managers, they can play a big role here. The perspective also to adopt, so adopting different perspective between, the outputs, different perspective between Asian guidelines would lead to different outputs. Aligning also criteria, aligning terminologies. As we said, for example, Asian guidelines, they are using very similar criteria, but sometimes terminology can be different, but also the weight of many factors, especially contextual factors, can differ. For example, HE is well known to, attribute an important role to criteria like cost effectiveness or, in general, economic analysis. Managing conflict of interest, the way of managing conflict of interest also is important and has a big impact on deliverables. Transparency, but also methods for evidence synthesis and also approaches to structure the evidence. Next slide, please. A few words regarding one of the groups that are working on building stronger collaboration between HTA guidelines and beyond is the GINATA group. So GINATA is a joint initiative between International Network of Agencies for Health Technology Assessment and Guidelines International Network. It was created in 2015 in order to explore synergies between these two words. It is composed of steering committee with 5 members and a bigger working group, including members from INATA and GIN members. Next slide, please. So, GINATA was created because we know that even though, clinical practice guidelines, they are more known to support clinical implementation, whereas HTA is more known to support policy implementation, these two words are very similar. And more similar than they appear at first sight. Next slide, please. This group was created in order to create more opportunities for collaboration through exploring common methods, promoting common projects, and sharing of products. And in this context, a lot of successful experiences at the intersection of Asian guidelines, of course, with their challenges and benefits, have been shared and discussed with large scientific audience in many conferences like HCAI or Guidelines International Network. And one of the future goals of this group is taking as starting point the theory of everything paper is working on, a tool or a framework, practical framework, in order to operationalize better the collaboration between these two communities. So a first version of this framework has been presented in the GENE conference in Toronto last year and has been improved based on outputs of the attendees of the workshop during this conference, and many other workshops and opportunities will be created in order to improve this framework for a better implementation of this collaboration. I will stop here. Thank you so much for your attention.
Thank you, Muna, for giving a very practical example on how frameworks and also structural approaches can help to build partnerships and break the silos. We unfortunately won't have time to take questions for panelists and let them to answer here in speaking, but please feel free to post them on Q&A and we will address them in writing. And thank you to all speakers for your insights and inspiration. And now we will start the interactive session of today's session. We are sure that our participants who have been following us have wealth of experience and insights in building and sustaining effective partnerships and collaborations across evidence ecosystem. And we would want to tap into that and into this wealth of knowledge and to understand how different roles in the evidence ecosystem experience collaboration and partnerships, as well as also to facilitate sharing of good examples and suggestions. I would now like to familiarize you with the instructions for engagement session, and please take careful note. And can I have the slide for guidance? You will see the instructions for the translation in the chat. There are translated version, but the first step for you is to think you as an active participant and identify yourself either as a knowledge user, basically who is the recipient and uses the knowledge to make decisions or take actions, or knowledge producer who generate evidence, knowledge intermediary who packages and prepares evidence for policy or decision making, or finally funder of evidence to policy action who provides resources to enable efforts in this field. We will use the Padlet tool. Links to respective Padlets are in the chat, or at least they should be. You should click on the one that refers to the role you are currently most identified with. We recognize that many of you may have several hats, but in order to facilitate this, you need to pick one. There, you are kindly asked to answer 3 questions. Firstly, do you have a positive experiences that you want to share where collaboration or partnership between stakeholders or organizations across evidence ecosystem has strengthened the science policy decision-making interface? And you can see that there are possibilities to provide input either on international level or national level collaboration. So please be careful to choose the right one. Secondly, as we also heard, partnerships building is not only without challenges. So we want to hear from you what challenges you perceive in the partnership collaborations you participate in, and what are the potential solutions to overcome these barriers. So maybe the solutions part is even more important. And finally, is there any way the evidence community can support your partnerships collaborations, and how so? You will have until 5 minutes past 2. We will check how you are going and doing before we invite you back. And we invite you to provide your answers on the Padlet. And before we advance with providing a bit of feedbacks, highlights, but the Padlets will remain open, and you can come back and add if you remember to, if you recall something that you would want to share later. So I hope that everyone has found their Padlets in your respective function, and you are working to provide your input that we are eager to follow. And we let you work a bit and think and share your experiences with us. And indeed, as my colleagues remind, that please don't leave the Zoom call. Keep it open. We will come back soon. Do it in parallel, and also we leave the slide on for you to come back to in case you will need some further guidance. I hope you will be very active in providing your feedback and suggestions and examples, because this is your opportunity to share what you do and what you have experienced. So we are very eager to learn from you as well. Thank you. The audio is not off because we are at the moment, I see questions from the chat, but at the moment there is interactive session. There are links in the Padlets, to the Padlets in the chat for those who have joined us later, where we have asked 3 questions to tap into the wealth of knowledge that our participants have, to further analyses and highlights of your work and inputs. And as I see in the chat, there links to the Padlets are put up once again, and we have time. We are still a bit of time for you to make your input on the Padlet. I hope no one has facing any issues, but if there is, then please do write on the chat, and my colleagues will help you to overcome any challenge you may have. Also seeing that we have new people joining, then please take a note on the slide for the engagement session, and the links in the chat for Padlet links, because at the moment we are asking the participants who are working on the evidence to policy field to provide their experiences and challenges, and as well as the needs for support in building, sustaining partnerships and collaborations. And also, don't focus only on one question, but be sure that you can cover the questions that where you wanted an input, because soon we will return to the plenary where our panelists will provide some highlights from your contributions. We'll leave a couple of more minutes before we convene. Can I ask that we start with already showing one of the Padlets and start with providing feedback? I understand that there is one particular Padlet, which is the knowledge user, which has been very actively been inputted by you. So it's been a wonderful sharing of experience and suggestions going on. Can I ask now Soledad to give a quick overview of what you see, because those who are working on other Padlets are not joining the others. So maybe just a bit of commentary on what is going on there. So curious. Thank you.
Thank you, Marge. Yes, there's a lot going on, actually. Glad to see so many experiences collaborating. A lot, well, in health, there are several experience and long-lasting collaborations. Cochrane is one great example, and there are networks provided by WHO too. But there are questions about how to approach, how to cross boundaries, how to cross from people who is in the field to policymakers or decision makers. I would, well, this is a very close to my heart because I'm part of INSA, but I have found that INSA, the International Network for Governmental Science Advice, is a great international resource. We have a lot of workshops creating capacities. We build capacities in Latin America, in Asia, in Africa. We will actually have our global event for INSA in Africa next year. So you can have more of an interdisciplinary experience in INSA with other people from other fields that are not only health related. If you're interested in that, I will suggest to go in that direction. Red Cross, I can see Red Cross also a great resource. But yeah, personal relationships are very important because you can find what others are thinking about, what are their problems. Usually policymakers' problems are different from field people. And if you can find someone who shares your interest, your problem, and wants to solve it, then you can work together. That happens because of different reasons, because of timing, but also because of where you are. So I will just encourage you to keep going around looking for collaborations, looking for places, asking other colleagues who you have been working with, where collaborations have been fruitful, and what kind of resources they are using. Open Science is a MOOC. There's a lot of educational resources for free MOOCs that have been opened by different universities, Harvard, Oxford, MIT. Very different universities have put up educational resources for free that you can use. So you're gonna be looking at too many resources. Try to find whatever is that you are looking for and share it with your colleagues. But there, as you can see, if you can skip from your Padlet to the others, there are a lot of experiences and good experiences. I don't know if Ruth wants to jump in too.
Thank you so much. I'm sorry, my mouse was on the wrong screen. I wanted to just pick up on some of the challenges and solutions comments. And I think there's a bit of a theme in there about respect and how important it is to be able to encourage all of the partners, especially in a new partnership, to meet on equal footing and to recognize that you are going to learn as much as you share, and to be very respectful of the evidence, the knowledge, the experience that other people bring, and that level playing field in partnerships is crucial. There have been a lot of questions in the Q&A around a decolonial lens and how to build more equitable partnerships, and I think that that's really key. So thank you very much to those of you who shared in the challenges and potential solutions, some of the tricky things that haven't always worked well. It's an amazingly rich set of contributions on the board, and it's been great to be able to observe them. Thank you.
Thank you. It really looks like there has been a lot of input, and we will go through your inputs in more detail after the session, and it will be very interesting to have an in-depth look. But now let's go to the evidence producer side. So Holger, would you want to comment on this one? Because I see that there is also quite a lot input ongoing, and what are there?
Enormous activity, Margaret, enormous activity. It's been quite interesting to observe this Padlet. So great idea to set this up this way. So it is very difficult to summarize because some participants are still providing comments, but I think there's a few common themes. So first of all, that in general, participants see great value in collaborations. There's great value in collaborations, but I'll get to a few of the issues related to that. There's quite a few case scenarios that participants provided, so this will be helpful for follow-up work without going into some of the details. But so lots of examples. What becomes obvious in terms of challenges is that oftentimes it's difficult to create initial contacts and participate in initial collaborations that might be ongoing on a specific topic. Funding is an obvious issue. There is several participants have mentioned challenges around global North, global South collaborations, and in particular maintaining them. One participant mentioned that these relationships sometimes are unbalanced, even abusive, and that obviously would have to be addressed. There are issues, sometimes very simple issues, such as technical issues, access to the resources that others have access to, and follow through. Once collaborations are established, it is oftentimes difficult to follow through with them, and in particular when it requires balancing out uneven knowledge and resources. And then I think in terms of the support needed, I think that support that is needed follows directly from the challenges and solutions that were mentioned. I think that came up a few times, but there are also issues such as frameworks for what is called here contextual evidence, factors that help with translating information into practice. That was mentioned by a few individuals, but the list is very long. I stop here, Margaret.
And indeed, it seems like as with the previous Padlet, that there has been a lot of interaction and discussion ongoing, and we will follow up these as well. And great summary, Holger, for this, although it is, as you say, almost impossible to summarize, but I think it's also good to give a bit of flavor for those who were working on other Padlets to go and see those inputs from other knowledge users, to have the policy the knowledge producers, Padlet, and vice versa, to also understand each other's challenges. And maybe that's also one way to promote collaboration as well, beyond putting your inputs and suggestions on the Padlet. I see that you wanted to come back with some.
Yeah, Marga, I just wanted to emphasize one point. I think there's a wonderful list of many case examples that I just to reassure the participants that this is not in vain, right? That we can go through and follow up in particular because many individuals have provided specific, have not made anonymous comments. So we wouldn't do it justice if we wouldn't follow up from here on.
Absolutely. Over. That is our idea. As I, in my introduction, mentioned that we would want to look into details, and that's why we were also asking to identify and put your country names to really see and how we can build on those and use these examples. And then we have, is there anyone wanting to comment on the knowledge producers? I think that's Holger only. So we go then knowledge intermediary, where John and I believe also Muna was looking at. So John, can you start off with knowledge intermediary inputs?
Absolutely. So I think the interesting thing is we had participants who seemed to be both knowledge intermediaries in the sense of drawing on existing evidence regardless of who produced it, and then people who are researchers who aspire to be working as knowledge intermediaries, and I would hope bring in other people's research, not just focusing on their own. When it came to experiences, lots of rich examples of international collaborations, often built around specific forms of evidence. A very powerful example, for example, from the European region with a regional forecasting hub that brought together different forms of forecasting units, but also some very powerful national examples like the Zambia National Health Observatory that brought into one place all of the data analytics that can support decision-making. So again, focused on a particular form of evidence, but a very powerful way of bringing it all together so that people can find it very easily. On the challenges front, there was the very important point made around often a lack of funding for primary research. So a lot of knowledge intermediary work is trying to harness the evidence that already exists in very rapid timelines to support advisory and decision-making processes. But if there haven't been those investments in the research infrastructure and in the primary research, then there's very little of that national evidence to draw on to put alongside global evidence. So that's a critical form of, or a critical challenge that we need to pay attention to. For the supports, a lot of comments about the need for supports for networking so that we can better learn from one another, both within countries across forms of evidence, across countries with similar and different forms of evidence, but also a call for very pragmatic things like how-to manuals. How do you set up a platform that can provide that type of timely, demand-driven evidence support that is aligned to advisory and decision-making processes? Huge amount of incredibly rich information. I'm just trying to share some of those high-level themes. Back to you, Marga.
Yes, thank you, John. It's really sounds like it's a great resource to go into more detailed manner. And Muna, do you want anything to add on this? Because we also had a funder, Padlet, which did not attract that much interest, and Muna was stepping in for the knowledge intermediary side to provide input for that one because of the lack of trust in the other one.
Actually, I didn't have the time really to check on the knowledge intermediary Padlets, but we have very few funders. So we have, I think, 2 or 3 comments. If you can share the Padlet on funders. Yes. Okay. So here, what you said here is that there are mainly two international collaboration that were mentioned by participants. The first one is the Coalition of Evidence in Brazil, and the second one is meaning a multi-country collaboration, which drove key decision on product development and strategic options on implementation and prioritization by the countries. Regarding national collaboration, one participant mentioned the importance of partnership between government and university for evidence production and use in order to improve the ecosystem. And one major challenge has been reported. It is the political barrier, and I guess, you know, here is I would say the use of evidence in policies at the end. This is all what we have. So yeah, I guess that we don't have much funders in this session.
Yes, that looks like they identify themselves as the others. So maybe can I also ask other panelists on the screen, and as we are closing the session, it's just to summarize the synthesis of the extremely rich input from the Padlets that, as promised, we will look into with my colleagues and other organizers of that Evidence to Policy Summit, and to follow up on things, as well as to strategize on how we can provide support in those areas that were mentioned more frequently. What we heard from the inputs of the synthesis was that the people, on irrespective of the function that they are identifying with, see the value in collaborations, and there are wealth of experiences and case examples that we can draw on. The resources seem to be of concern to all the sides, as well as what came across at least two Padlets was that the respect and equity in collaboration is very important, and this needs to be kept in mind when setting up partnerships and collaborations, that they should be in equal footing. And I think it's not only within a community, but beyond. And also there were resources. I saw that the resources that were where you can tap on, and also sort of that made the suggestions and shared different resources there in the chat as well. You can go and look. So that's really in a nutshell the overview of overviews of incredible rich input that we are very grateful for you to provide. And if you, as I said, these remain open, and feel free to go back and read what others have been provided. And with this, I will close the session, and we would like you to provide in the Zoom chat one word that sums up the session for you. So please, if you can go to chat and try to summarize, as we and our distinguished panelists try to summarize your input in the Padlet. So now we are asking you to summarize in one word, and we thank you for active participation and providing your inputs, and thank you our panelists, and handing over now to our day moderator Fadi to lead in the next steps. And thank you from my side, everyone.
Thank you, Mark. Thanks for the fascinating sessions. Very, very insightful and a lot of key messages, wonderful input, on Padlet, amazing input. In fact, a lot to actually think about as we move forward. I want to remind also everyone that the Padlet, as already the chat moderator already put on the chat, that it will be still available on the EVIPNet LinkedIn. So, if you want to keep that conversation going or additional input you want to provide. But thank you so much. I think we've learned a lot about how important to think about differently about collaboration and partnership within the evidence ecosystem. I think there's no one size fits all. Lot of interesting experiences, insights, lessons from other systems, from other countries, from other platforms. Lot of opportunities to actually be creative, to innovate about how we can strengthen collaboration and partnership and work collaboratively within the evidence ecosystem. And I'm sure there's a lot actually that can be said as part of the insight that came out from this session. Now let me so thanks everyone for this session. I think what we will do now, we will invite you for a very short break. And I mean short, and perhaps during this break you can maybe stand up, walk a little bit, and maybe just have some rest before we convene in around 7 minutes from now. And please, I urge everyone to keep logged in to the system. And certainly we have a very interesting panel that's coming up in around 7 minutes, and this is about citizen-backed evidence. Very interesting insight. It'll be interactive as well. What I will do as well in this short break, if I can invite as well, I'm not sure, Alex, if you will be ready, but the amazing, I have to say, the amazing work that you are doing when it comes to the drawings of the summit, journalism. So if you have, feel free to put any drawings on the screen, and we can really certainly reflect on it, look at it, enjoy it while we are taking our short break. Welcome back. Perhaps we can see now some of Alex's drawings. Thank you, Alex. And this is really quite fascinating of how you really summarize visually in a drawing all what we have learned from this plenary. And I think, you know, the theme on working together, and I think we can do so much when we work together, building collaboration, partnership. I think this is clearly showed why collaboration partnership would be beneficial and how it can save the world and how we can be prepared for and deal with complex problem and deal with uncertainty. Amazing discussion about the marbles for sure. Certainly, you know, collaboration required for providing timely, demand-driven, evidence support aligned with advisory and decision-making processes. Certainly, this is well said. Certainly, we looked at the factors, the enablers, barriers that could really influence decision-making, and how we strengthen, and how and why we should strengthen collaboration across decision-making disciplines. Very interesting drawing. Thank you so much, Alex. So let me just maybe introduce the second session for today. Distinguished participants of the second day of the Global Evidence to Policy Summit. I'd like to welcome you back from this short break. I would like now to introduce our moderators for the Citizen-Backed Evidence Plenary, which is engaging citizen in providing evidence synthesis support panel. Maureen Smith, the co-chair, Citizen Leadership Group, Evidence Commission Canada, and Richard Morley, Consumer Engagement Officer, Cochrane, United Kingdom. The panel, I wanted to mention that this panel is co-organized with the Cochrane and the Evidence Commission. Over to you, Maureen and Richard.
Well, hello. Thank you very much, Fadi, for your warm welcome. And hello, everyone. Welcome to today's next session, which is called Citizen-Backed Evidence, Engaging Citizens in Providing Evidence Synthesis and Support, including for evidence-informed policymaking. So I'm Richard Morley, as Fadia said, the Consumer Engagement Officer with Cochrane, and I'm based in the United Kingdom. And I'm pleased to be one of the moderators for today's session, along with Maureen Smith. Maureen, hi, would you like to introduce yourself?
Thanks, Richard. It's great to be with you today and to be with these wonderful panelists. So I'm here today as the co-chair of the Citizen Leadership Group for the Global Commission on Evidence to address societal challenges, and I'm calling from Ottawa, Canada. So in addition to being part of the E2P Summit, today's webinar is the second webinar in our series titled Putting Evidence at the Center of Everyday Life, a global webinar series for citizen leaders and citizen-serving non-governmental organizations. You may watch the recording from our first webinar in the series, and we've just opened registration for the third session in the series called Battling the Bunk, Bringing Evidence and Citizen Engagement to Bear in Addressing Misinformation, taking place November 2nd, 2023. We encourage you to register and to bookmark the registration. We'll bookmark the registration link in the chat.
Thanks, Maureen. So this series is co-hosted by Cochrane, the Evidence Commission, and the World Health Organization's Evidence Informed Policy Network. And all the partners have seized the opportunity presented by the COVID-19 pandemic to recognize the need to involve citizens in the evidence cycle, from co-production to the use of evidence. So if you're on social media, we do encourage you to tag our organizations and use the hashtag #evidence4life. And please note as well that we're recording today's webinar, and we'll be sharing the recording and slides after the session. So as Maureen said, we have an outstanding range of speakers joining us today, and here they are listed in their in their order of appearance with their organizational affiliations. So thank you to Clara, Laura, Vichan, Mike, and Alessandro for being here today to share your insights, and we'll hear from you shortly. Brenda, unfortunately, isn't able to join us today. Maureen.
So we've asked each of our speakers to take 3 minutes to address one of the 3 questions you see here on the slide. Following the panel, we have time to take your questions. Please use the chat box to pose your questions at any time throughout today's webinar. Our colleagues are on hand to answer your questions and share resources in the chat. And we're also asking our speakers to try to take questions in the chat.
Thanks, Maureen. So following the panel, we'll move on to a different section, a participant engagement session, and we'll give you more instructions at that time. So for now, let's welcome our first speaker, who is Clara. Clara is with the Knowledge to Policy Center in Lebanon, and she'll be addressing the question, how can citizen engagement contribute to evidence-informed policies? So over to you, Clara.
Thank you, Richard. Thanks, Maureen. So initially coming from a clinical background, back then we have constantly advocated for patient involvement in decision-making as an initial step to ensure holistic, inclusive patient care. Now, this being said, it becomes paradoxical when decisions or policies could affect more than one life. At some instances, countries have failed to engage with utmost important users, which are citizens. Meaning where policies affect youth, who will know better about what affects them and their challenges more than the youth themselves. So the same applies when it comes to systems response to challenges and emergencies. And there had been evidence and documented evidence that clearly recognizes the importance of citizen engagement during epidemics and pandemics, and where health system response was most efficient and effective was where the engagement happened. Now, let me take you back a few years backwards, where the Knowledge to Policy Center, we were working on a policy related to early identification and intervention of children with disabilities and developmental delays. And we have noticed that there are several health system challenges that prevent identification of children with disabilities at an early stage. You might say, well, solutions are very clear. The evidence says develop tools, roll those tools on hospitals, primary healthcare centers, schools, say what, train the staff, and then we have a system that is up and running. Now, it might sound easy, yet there was insufficient local evidence on this issue, and the topic was not of priority to the stakeholders. For this particular knowledge translation process, we have engaged citizens not only in understanding the current governance, finance, and delivery systems, but also to take part in the national policy dialogue that engaged several policymakers around one table. And what we have noticed is that where evidence was clear-cut on the solutions, contextually, a father whom we have engaged with in one of our citizen consultations, whose son just turned 6 years old, not knowing that his son's speech delay was due to hearing difficulties and had no idea where or how to get his son assessed or even access services. So this clear-cuts the importance of contextualizing the evidence-informed policies to make it relevant to the context that we have through citizen engagement. Now, not only that, but because this topic amidst several crises that we have was not of priority for decision makers or policymakers. And policymakers had to hear the reality from those that are living through it to elevate it to the political and policy agenda. Now, citizen consultation in the overall framework of evidence-informed decision-making process, it's dynamic, meaning it's constantly molded more into the actual output that we are aiming to establish. And therefore, it can be implemented from priority setting to the design, to the contextualization, or even evaluation and implementation of evidence-informed policymaking. The key in this process is to ensure that we engage the citizens and well inform them prior to the citizen engagement and during the citizen engagement, and to implement systematic approaches when the citizen engagement is happening. Now, this does not come without a cost. There are several challenges typically in citizen engagement, from the selection of participants and so on, but sometimes we don't have the luxury of time to go with an extensive process of consultation. But when there isn't a luxury of time to do so, at least a small scale level of engagement is very important to contextualize and ensure ownership of evidence-informed policies. Now, finally and ultimately, to achieve policies that are adaptable, relevant, and implementable, it becomes imperative to start transitioning towards multifaceted, systematic approaches of engagement that encompass the participation of citizens themselves. Thank you, everyone.
Thank you so much, Clara. That's a really powerful call, I think, to us all to engage people, and a revolutionary possibility, I think. So thank you. And we're going to move on now to Laura. Laura is with the Instituto Veritas in Brazil. She'll be addressing the question, how do different organizations manage trust or distrust in science? So over to you, Laura.
Hi, everyone. Hi, Maureen, Richard. Thank you so much for inviting me to join. I'm a very fast-speaking Brazilian, but I am mindful of our interpreters, and I'll try my best to speak as slowly as possible. I also don't have slides, so this slide is just for all of you to know where I come from. But I was put into this task of speaking about distrust, which is a very important topic in my country, in Brazil. Gaining as much support from citizens and diverse citizens is quite essential to implement any policy or even any knowledge finding in Brazil. So my main points here today is that it seems quite obvious, right? But to battle distrust, of course, we need to build trust. But this is often something that we say out loud, but we are very hard doing. In my experience, building trust means not overselling science for citizens. Often we try to sell our findings or our work as something very important, but for most citizens, what is quite important is their demands, is their day-to-day lives, is their context. And often our science doesn't get to these topics so easily. So we need them. And we can't build an hierarchy and expect trust to be given to us. So we, both in Instituto Veredas and in the already mentioned today Brazilian Coalition for Evidence, and in our other regional collaboration, the Latin America and the Caribbean Evidence Hub, we work so hard. We really deposit as much time as we can, building trust, building meaningful relationships, being as transparent as possible, as responsive as possible to any citizen that we are engaging from the get-go. This means really engaging citizens in the early stages of any evidence-informed policy-making process, being completely upfront about what methods we will apply. Often we don't speak about methods with citizens because we imagine people won't understand what we are talking about. But if we can't explain what we are doing in a very simple language, probably we are not doing science well enough. So it's quite important to be able to speak about methodology, to engage citizens when we are first drafting what our research and policy questions are. And something that Professor Sandy Oliver in the UK talks a lot about, and I'm very inspired by it, is being completely upfront about our uncertainties. Because if we try to oversell science, as I mentioned, probably we'll have many distrustful partners jumping in. My other topic for today is just helping to create an environment where people feel comfortable and they feel they can indeed contribute to science by sharing something they know, they feel, they think. So giving proper space for citizens to reflect on their context, to understand the gaps from whatever findings we have, and invite them to contribute is something quite important. In our work here in Brazil, equity is a main word for any kind of evidence to policy interaction. And we found that inviting citizens to help us understand inequities, help us understand topics such as gender inequity, racial inequity, how the different experiences depending on where you live affect our knowledge and affect our policies, is a great way for people to feel they can contribute to science, feel they can contribute to the implementation of any policy strategy, and really brings people closer to trying to find solution to these barriers. That is something that we really need support. So these are my main topics. I know it's quite obvious that to manage this trust, we need to build trust, but I would say that it takes loads of time, loads of mindful effort, and really considering how can we build a equal environment that everyone feels comfortable sharing what they feel, and being very responsible that when I ask someone to share what they experience, I need to really take this into account, and they need to see this reflected in the knowledge and in the policy that I'm building afterwards. So this is my comment for today.
Thank you so much, Laura. Some really important issues there. The infodemic, which the WHO has identified as such an issue, a problem for people involved in evidence. Thank you, Laura. So Maureen, over to you.
Thanks, Richard. So I will be introducing the next three speakers. We'll start with Vicharn. He's with the Prince Mahidol Award Foundation in Thailand, and he will be addressing the question, what strategies have organizations applied to engage initiatives that promote citizen-backed science? Over to you, Vicharn.
Thank you. Hello, everyone. Can I have the slide, please? I will share with all of you our experience on Thai system approach of citizen-backed evidence. 31 years ago, Health System Research Institute, or HSRI, was established. It is a governmental autonomous body attached to the Ministry of Health. As shown in the diagram, evidence generated by HSRI gave birth to the other 5 organizations in Thai health systems. This diagram is a very oversimplified version of our health systems to illustrate evidence-informed organization structure and behavior in our health systems. Thai Health Promotion Foundation was born 9 years later. It is a mechanism to use 2% of tobacco and alcohol tax to promote health of Thai people. Each year, Thai Health uses about $120 million tax money to support lay people around the country to take part in the health promotion and disease prevention activities in their communities, giving rise to collaborative development of healthy lifestyles in the communities, and communicate to the general public for national policy development. 1 year later, National Health Services Organization was established to manage Thailand's UHC, or Universal Health Coverage, enabling the country to spend less than 5% GDP to cover high-quality healthcare to all people, with evidences generated by the 2 organizations in green on the right. It took more than 10 years through action research to establish an NHCO, or National Health Commission Organization, a citizen-engaged, evidence-informed policy body. NHCO uses many tools to get citizen engagement for health policy development at various levels. One powerful tool is Health Assembly, participated by the people. These health assemblies must be chaired by a respected person who is non-health professional. One major common mechanism for all three organizations in deep blue is the governing board of each organization must consist of members from various sectors, including citizen groups representatives. The two organizations in green on the right, namely IHPP, or International Health Policy Program, and HITAC, Health Intervention and Technology Assessment Program, are evidence-generating organizations which work in both citizen engagement and policy engagement manner. They produce evidences to make Thai health systems a learning and wise system in the way that it both directly and indirectly backed by the citizen in evidence generation. Let me emphasize that the three organizations in deep blue are citizen-backed user of evidence. Thank you very much.
Thank you. Thank you so much, Facharn. It's wonderful to see the infrastructure that you've built to ensure that citizen engagement is part of your evidence system. I'm going to our next speaker is Mike. He's with the McMaster Health Forum in Canada, and he's addressing two questions. What strategies have organizations applied to engage initiatives that promote citizen-backed evidence? And how can this citizen engagement contribute to evidence-informed policies?
Thank you, Maureen, and thank you for having me here today on the panel. So I'm going to address these two questions in an integrated way and with examples, because I think these two questions are in a way best addressed together because the best strategies are designed to support evidence-informed decision-making. So I'd like to just share a few examples with you with the time that I have. So the first example I would like to share is a new citizen engagement and evidence-informed policymaking guide that's going to be coming out. So in the fall, the WHO will be launching a new guide to many publics that focuses on citizen engagement and evidence-informed policymaking. You're authored by Oliver Escobar and James Henderson, and I acted as the chair of the editorial team. The guide to many publics, it focuses on many publics as a specific form as citizen engagement, with an eye to being able to adapt them to many different contexts. Many publics are forums that can include a cross-section of the population that are selected through a civic lottery to ensure that you're engaging citizens from all walks of life, and with an aim to inform policy and action. The guide provides a really helpful overview of how to organize many publics in the health sector, and is organized into 5 chapters, and those chapters collectively give a learning process for those who might organize, commission, or facilitate a citizen engagement project. The first chapter focuses on many publics as a form of citizen engagement and evidence-informed policy, and then the other 4 chapters then focus on very practical steps that are needed to organize a citizen engagement project that focus on the inception, the preparation, deliberation, and influence. Once launched, Tanya and her team are planning for some capacity building workshops, and to find more details and receive updates about those, please do sign up for the EventNet LinkedIn group that will provide those announcements when they're available. The other examples I would like to share, I want to highlight 3 examples of how myself and others at the McMaster Health Forum are engaged in citizen engagement initiatives to contribute to evidence-informed policies. The first are citizen panels, and this is one form of many publics. So our citizen panels There 14 citizens are engaged with diverse backgrounds and lived experiences to deliberate about pressing health and social system issues. We pre-circulate a plain language citizen brief that describes what's known from data and research evidence about a problem and its causes, potential solutions to address it, and key implementation considerations. And participants are then convened to a virtual or face-to-face deliberation where they can share their ideas and experiences on the issue and learn from research evidence and views from others. We typically aim to convene these panels prior to a stakeholder dialogue that convene about 20 to 22 system leaders, so that those actions are prioritized to address an issue by decision makers, including citizen leaders, and that those deliberations with system leaders are informed by the ideas, the experiences, the values, and preferences identified from the panels. We've found that convening the panels in this way can have profound impacts on deliberations among system leaders, including identifying policy options that are acceptable to citizens. We've also convened an integrated set of what we call living citizen panels and dialogues that focused on the politics of a health human resources crisis in Canada, where the citizen panel was reconvened with the same people with an updated set of issues to deliberate based on what was found in the first panel in the next dialogue, and then helping to inform the subsequent dialogues that came after it. So the second example of citizen engagement I have is for conducting contextualized evidence syntheses that are produced in a timely and demand-driven way that engage citizen partners in key stages of that synthesis. So this can include framing questions in scope, reviewing and interpreting results, and co-designing dissemination materials and plain language summaries and infographics. And a recent example that we're working on is a living evidence synthesis of approaches to address misinformation that has engaged 4 citizen partners in the grant application. That includes Maureen, who's chairing the call today, and who collaborate as part of the research team. So the first version of that will hopefully come out in September. And then the last example, which you might have heard in the last session, is acting as the co-lead and secretary for the Evidence Commission, which has prioritized putting evidence at the center of everyday life as one of its 3 implementation priorities. A key part of that is focusing on ensuring that citizens have access to best evidence, evidence-checked claims, and simple-to-use evidence-backed resources and websites to make choices at all times and not just during global crises. So I'll end it there. So thank you, everyone.
Thanks so much, Mike. And I'll take my moderator's privilege. And I've had the pleasure and the privilege of attending some of the citizen panels that McMaster holds as an observer or as a note taker. And I think the one that you talked about, the living evidence panel, I had never attended something like that where you brought the people back together again. And there was a lot of, it was very powerful. And I still have really, I was marked by the reflection that people had done from the first panel to the second panel. So thanks for presenting that, Mike. So our last panelist is Alessandro. He's with the Organization for Economic Cooperation and Development in France, and he'll be addressing the question, how can citizen engagement contribute to evidence-informed policies? Over to you, Alessandro.
Thank you. Thank you very much, Maureen and colleagues, and also thank you very much to participants for the very rich conversation in the chat and in the questions. What I wanted to do in my 3 minutes was to address the issue of citizen participation in evidence-informed policymaking, especially focusing on the role that deliberative practices are now taking in most, I would say, most countries around the world. Now, the first, I would say, good news is that deliberative practices are on the rise. In our latest survey, we have identified more than 600 practices around the world that meet our criteria. So I will put the air table here in the chat if you want to have a look at it. Obviously, this is not comprehensive. It's based on desktop research, so there are limitations of language, etc. But it gives a sense of the diversity and the importance that this practice is taking. However, involving citizens in evidence-informed policymaking through deliberation has both advantages and disadvantages. And I wanted to briefly mention those because I think it's important for the future of our democracy that we address those to make sure that deliberative initiatives are actually successful and don't leave citizens disaffected or unhappy about the experience. Because in fact, the first, I would say, most important issue to be addressed is how we can move from deliberation to implementation. Deliberation refers to the act of citizens during the initiative, that the fact that they deliberate on a specific topic. And one of relevance for today's discussion is, for example, the very recent Citizens' Assembly on the end of life law in France, which happened before the summer, was closed before the summer. So citizens did deliberate, and a report was sent to the Prime Minister, to the President. However, we will have to see now how that is transformed into a new law. Obviously, this is key to give value and respect the time and effort of citizens. And obviously, this changes a lot according to when the deliberative exercise is taking place, meaning at what point of the policy cycle. If it is done in a moment where it is still possible to influence the policymakers or parliament or not. And this brings me to the second issue that is becoming more and more important, which is some frictions that are happening between deliberation and representation, meaning what is the role, the respective role of citizen assemblies vis-a-vis, for example, the role of parliament when coming to a decision on a law or on a policy. Now, this is obviously very important to address for the success of the event, because otherwise citizens would feel completely betrayed by the exercise. We have developed at the OECD a series of guides to help policymakers and citizens to organize. You can find them in the link that I've just put in the chat. But obviously, many more are in the making, including the one that Mike just mentioned. It's not the knowledge that is missing; it's the capacity to transform this knowledge into good and successful practices. And just to conclude my intervention, I focus on deliberation because I think it's the most interesting and vital initiative that is taking place in this field of citizen participation at the moment. But obviously, there are very many others, consultations, etc. And this can become complex for policymakers, for civil society activists to understand what is the best way to be engaged in a policy cycle. And therefore, we have decided. I'm very sorry. I have a colleague speaking, but I will surely ask her to lower her voice, please. I will surely conclude my intervention in a second by linking my last publication that I mentioned, which is this guide on citizen participation processes that I put in the chat. And I apologize for the eagerness of my colleague to speak.
Thank you, Alessandro. Really comforting to know that deliberative practices are on the rise. And thank you for putting those resources so that we can share best practices and guidelines and work together on this. Okay, over to you, Richard, for the Q&A.
Thanks, Maureen. Right, so we've just got a few minutes, just 5, because we're running slightly late, just to try and answer a couple of your questions live before we move on to the next session. So I'm going to start by picking out one interesting question that was asked by Denise Razuk, which went, please, Laura, can you comment on how the political context affects trustful relationships? And she referred to the kind of populist government that was recently in power in Brazil, and what clues you might suggest, to respond to that element, which is to a degree undermining confidence in science. Laura, how might you respond to that?
So I type an answer for Denise, but just would like to highlight that the political context is always affecting interest in science for the better or worse. And usually what we try to do if we have a very negative context around science is focus on the micro politics and the community level engagement to help and develop multiplicators that are community members that can develop skills of critically appraising the process of producing evidence or the types of information that are being presented, and really engage from the get-go in the co-creation and co-production. So they feel an ownership, and then usually are way better than us in multiplying this kind of knowledge in the local context. So I think usually when the macro is very bad, turn to the micro, and maybe you get some luck there.
Thanks, Laura. Really good answer. Maureen, do you want to ask or point out another question?
Yes, I do, and we'll have 2 minutes to answer that one because we want to get to our participant engagement phase of this webinar. So it's a question from Kate, and it really is about citizen engagement and how do you engage patients from the citizens from the very beginning. And I would welcome any of our panelists who would like to tackle that one. Laura just kind of basically touched on it at the end of her presentation to give us at this point a 1 minute answer to that question. And please note that in the chat, we're trying to answer, there's a team trying to answer as many questions as possible also. So who would like to tackle the challenge of getting citizens involved from the very beginning?
Maybe I can say something very briefly, Maureen.
Thanks, Mike.
From my perspective, what's worked really well is building partnerships with different groups that have networks of citizens or people with lived experience. And I mean, you've been such a resource in bringing some of those networks to our team at the McMaster Health Forum and the Evidence Commission and so on. But also when convening citizen panels, we've worked with many different groups who help with recruiting to different people who have lived experience, if that's the focus of the panel, or working with other groups who can recruit much more broadly across an entire population. So I think building those partnerships and sustaining them over time and working with them in a meaningful way is critical in doing that from the beginning and throughout a process.
Thanks so much, Mike. Okay, into the participant engagement phase of the webinar, and over to you, Richard.
Thanks so much, Maureen. Right, okay. Now we're going to move into the second half of our webinar. So this is all about citizen engagement tools and methods, some of which we've talked about in the first half of our webinar. And to kick us off, we're going to launch a poll. And that's going to ask you to rate your level of familiarity with citizen engagement tools and methods. So our IT team, our wizards behind the scenes, if you could launch that poll for us, and then we'd ask you to take part and identify whether what your experience is with tools and methods. So can we launch the poll? There's so much going on in terms of technology here. I can't see the poll. Yeah, here we go. You should have a pop-up in your screen now. It says, how would you rate your familiarity with tools and methods for citizen engagement in deliberative processes? We've been hearing a little bit about deliberative processes. So your choices are not at all familiar, barely familiar, somewhat familiar, fairly familiar, and very familiar. So if you could choose and submit your response, and we'll share the results in just a moment. I'll just give you a moment more to answer, and if our tech gurus could close the poll and share the results, that would be great. Thank you. Oh, it popped up for a second. There we go. So quite a range of responses from right across. I guess the smallest group is those who are very familiar with tools and methods. But, you know, quite a lot of us have some familiarity. Right. Okay. Thanks very much for that. Now, having thought about that, we'll move on to the next element of our interactivity. So, Maureen, this is over to you to talk about the Padlets.
Okay, so we're now going to invite you to interact with everyone on the call on Padlet. Just a reminder that the instructions are available in 6 languages, and that's in the chat. So if you're not familiar with citizen engagement methods and tools, then please join Padlet number 1 using the link shared in the chat box. Then Padlet 1 people will discuss 2 questions. What are you interested in learning about citizen engagement and deliberative processes? And which health topics do you believe should be prioritized for citizen deliberation in your country? So remember to stay logged into the Zoom webinar while you access Padlet. If you are familiar with citizen engagement methods and tools, then join Padlet number 2, where you will address 2 questions. What are the benefits of tools and methods you've used for citizen engagement for deliberative purposes and its benefits? And what are the challenges of these tools that you've used? What strategies did you employ to overcome them? So we'll let everyone get set up with Padlet, and then we'll come back. Richard and I will come back to check in on you, and just keep putting in all of your ideas and all of your insights into the Padlet. So if our IT people could launch that, that would be great. Thank you. Okay, and I see that the links are in the chat now. Padlet number 1, and then below it, Padlet number 2.
Okay, Maureen, I can start to see some of the comments coming in on the Padlet. Somebody's posted in the, well, is there anything in yours, Maureen, that you're interested in drawing to our attention? Or are you still waiting for people to post?
Yeah, I'm just coming into it now. Maybe you can go first, Richard.
Okay. So not a lot yet. Oh, here we go. Yes, actually quite a few. So there's a reference here to work that's being done by the National Institute of Health Research in the UK, and tools that they've been developing, and frameworks as well. So, for example, the United Kingdom, the UK National Institute of Health Research has been developing some standards for involvement, with which I'm familiar. And there's a reference to Cochrane as well, of course, which attracts my interest, working for Cochrane, about the work that's been done there relating to plain language summaries, and something called Evidence Essentials, which is a tool for engaging, or it's online learning to support involvement and engagement in evidence synthesis.
Padlet 1 is very busy, Richard. People have a lot of different interests in learning about the process. There's a common theme about priority setting, like who should be setting those priorities, and should it be about what the policymakers see as the most pressing issues, or should it be about what the citizens think? So that's quite interesting too, and things are just keeping on coming in. So keep populating those Padlets. We've got how many minutes have we got left? Not much.
Yeah, just 7 minutes, something
5
like
minutes
that, Murray.
ago.
Yeah, I wonder if any of the panelists who spoke earlier are on the call, and if you see anything that's in the Padlets, if there's anything that stands out for you, please do feel free to comment, particularly thinking about the topic that you addressed in your presentation, if there's anything that speaks to that, but anything that stands out for you.
So Richard, I'll just jump in very quickly and comment.
Good.
I think this comment here on how do we decide who will participate and who they represent is something quite important, because of course, when we are talking about citizen engagement, we're not talking about every citizen, any citizen. Some resources, some very interesting resources have been shared in the Q&A. Sharmila shared one typology they developed in Brazil. I think it's worth mentioning. Maybe it will be posted on the Padlet also. But usually from our experience, we try our best to identify voices we want to be heard and ask these groups to identify a representative and the way they would most like the engagement to be conducted. I also answered a question regarding this, but I think this topic on how we decide and how do we enable participation, not only logistically, but in a meaningful, equitable way, is something that has been coming up a lot.
Thanks so much, Laura. That's really helpful. I don't know if any of the other participants have anything that stands out. Certainly amongst the people who've identified themselves as more familiar, people are talking quite a lot about the difficulties of the challenges of ensuring proper involvement, engagement with, right across groups that are traditionally, have historically been excluded from research and involvement. That's a challenge that people have identified.
That's good to hear, Richard, because a common theme in the Padlet number 1 for the people who are not as familiar is exactly about that, about engaging with equity deserving groups, or in, and how to get those people to the table and all of those challenges. So happy to hear that there are, there's some discussion about that in Padlet too. And hopefully some of the people on the call will put in their resources in the chat if they do have resources, because that's certainly coming up as a common question from the people who are interested in learning more about those deliberative processes. So.
That's really interesting. The other thing that's I find really encouraging, actually, from the things that are being published, is the kind of global spread of resources. You know, there's countries here mentioned: Serbia, Myanmar, Canada. You know, right across the globe. When I think, kind of historically, typically, resources and activity have been found mostly in the Anglosphere, the English-speaking world, the developed world, and not so much in the global South and the non-English-speaking world. So to me, it's really encouraging to see the global diversity that's represented in the comments. Please do feel free to carry on populating these Padlets.
Yes, and to all our experts who spoke, just jump right in if you see something that you'd like to comment on. I'm also seeing in our first Padlet quite a bit of interest in behavioral science, and I think behavioral science has kind of risen to some more importance than we afforded it before because of the pandemic. And there's quite a few people who are interested in learning about the role of that and how citizen engagement can, the intersection of citizen engagement and behavioral science and all of those methods. So that's I found that quite interesting to see also. And as far as the health topics that people are prioritizing, I think every health topic in the book is there. I think the lesson from here is that health topics are really according to your context. So, we see topics that are based on what people are experiencing in those countries, basically. So it's like a medical book here. There's every condition is here, and that's quite interesting.
So Maureen, just to jump in for a few, I've noticed a lot of comments on the best way to engage citizens. So the evidence-informed policy processes of how do you develop the policies themselves is so multifaceted. So there isn't a straight answer to that. There are different ways of engaging citizens, from priority setting to the conceptualization of the topics themselves. So that's totally dependent of what we're trying to get out there. If we want to engage them because we want to contextualize the policies that we have, so that would be at the stage of the development process. If you want to identify what are the key priorities when it comes to a policy itself, so that would be kickstart from the beginning. So that is highly dependent on what we're trying to get out. Ideally, it will be through all stages. So that would be a continuous engagement from the conceptualization, priority setting, and up to the evaluation of policies. And ideally, that would be the best format. And that reflects back to some of the challenges that have been also reflected on the Padlets, where they're discussing time and biases and how limited it is when it comes to citizens that are not interested in being engaged. And to be very honest, yes, that's tough. The science of it is very tough, but keeping through the direct contact we usually have, and in our engagements, we have a person who's the outsource of the engagement that constantly has that brought together and keeps the communication going with the different citizens. And so far, we had an excellent experience in that.
Thank you so much. Okay, it's up to me to give the 2-minute warning. So if our IT experts could share Padlet number 1 on the screen, well, I think it's still open. You could still be populating it, but we're going to get some brief insights from our experts who presented on the panel today. So looking at Padlet number 1, if there's anything that resonates with you, or you would like an aha moment, or you'd like to comment, we would like you to unmute and share that with all of our participants. And just a big thank you to all the participants who've been part of Padlet number 1 and putting in all of your what your interests are and the topics that you'd like to prioritize. So briefly, if there's someone from the experts who'd like to comment, we would love to hear from you.
So Maureen, I'll jump very quickly just to comment that I see a great opportunity here because there is synergy among health topics that people would like to address. And if anyone hasn't put down their name or country, I would advise to do that, because we can have here a very simple, beautiful tool to connect different countries that might have the same priorities and want to work together. And this, of course, can make the work very easy and colorful.
Oh, that's lovely. Okay, over to you, Richard, for your Padlet 2 insights.
Okay. Yes, so that you can see on screen now the Padlet from those people who identified themselves as being more familiar with this area. Again, if there's anyone amongst our speakers who's got anything that they see, anything that speaks to them, yeah.
Can I? Yes,
please. Yes.
So 2 things quickly. One on the Padlet 2, and another one as a question in the Q&A. In the Padlet, there was somebody, I think anonymous, stressing the importance of communication for successful participation. This is an immense area of work, I would say, and I just wanted to touch upon it to say that at least from the way we look at things from the OECD, so from sort of the government perspective, the way government communicates about emergencies and in general about engagement opportunities is absolutely fundamental to ensure that citizens are willing to engage, are aware of the issue, and also represent a broader I would say, perception of society than their own, that they're part of a broader conversation before they start engaging. Now, very few countries if you look at our global report on public comm, which we published a couple of years ago, very few countries' communications offices are aware of the link between public communication and engagement. They still see public communication mostly as an exercise of politics or information, whereas in fact it should be much more. I'll stop it here because we don't have time, but it's a very good question. And the second thing is, well, how governments have reduced the space for engagement during COVID pandemic and how to avoid that in the future. I don't have a clear, easy solution. What I can say is that as the OECD, we have strongly stressed how the opposite was to be done, that in a moment of national emergency, opportunities for consultation should be increased, obviously making sure that they are done in a safe environment, which is absolutely possible. Unfortunately, it's a matter of political debate. At the national level, there's no global solutions. What I can say is that international organizations like ours, like WHO, should be very alert and stigmatize every time governments use emergencies to reduce instead of increase engagement opportunities.
Thanks so much. 2 very, very powerful points there. Mike, I know you had your hand up, but I'm afraid we've run out of time.
No problem.
So, Maureen, over to you to wind things up for us.
So on behalf of Richard, our partners, and myself, very heartfelt thank you to our expert speakers and all of you, all of the participants, for joining us today. We ask that you please register for the next session of the series titled Battling the Bunk, Bringing Evidence and Citizen Engagement to Bear in Addressing Misinformation, taking place on November 2nd, 2023. And that adjourns today's webinar. Have a good day, everyone, wherever you are in the world. And I will pass things back to Fadi.
Thank you, Maureen. Thank you, Richard. This is really quite, and thanks for all the panels. This was really quite a rich discussion about citizen engagement and citizen-backed evidence. Thank you so much for all the insight, and thanks also for all the participants for the great contribution and also insight that they provided over the Padlet. I would like to certainly, engage everyone, engage all the panelists, all the moderators today for a very engaging and I think important discussion that we already covered today on collaboration, partnership within the evidence ecosystem, but also on citizen engagement and evidence-informed decision-making and deliberative processes. I believe it has been really a great day for all of us in this summit. I personally learned a lot from today's discussion. I hope you all have enjoyed the panels and the interactive sessions. I would like to remind you, please, for everyone, just remember that we'll start our third day tomorrow at the same time as today. We are certainly excited to see you again tomorrow. And please do not forget to visit and join the EVIPNet LinkedIn group to connect with each other and also to engage with your peers. And for the Padlet discussion, will continue today as well over the EVIPNet LinkedIn. So before you leave the virtual venue, please, share, emojis are great. So please feel free to share your feedback with us about today using the emojis in the chat or the reaction button. I would like to also thank Alex for the great, insightful, fascinating drawings that you already put, summarizing all the discussions coming out from the panel, and they will be available as well later on. So have a wonderful day, afternoon, evening, and see you all tomorrow. Thank you.